relationship, we know that there's always three people. There's the client, there's the other individual, then there's the relationship. And I think that if we forget that, we start to see just so much complexity and confusion. And as mental health providers, when we get confused, we tend to get overwhelmed. And then that does give some opportunities to that individual along the narcissistic spectrum. And it could be both partners as well. It could be a singular individual or it could be both. And that adds so many challenging aspects. So we have to know what we're looking for. We have to keep an eye out for what I call the shotgun effect, being aware of being overwhelmed and possibly trying to maintain an equal balance in session and in the course and trajectory of treatment. Because once that balance is offset, that's when we get a lot of destructive behaviors. That's when we get a lot of resistance. That's when we get a lot of those relationship factors, not only the therapeutic relationship, but it also manifests in the relationship of the individual who's along the narcissistic spectrum, but also in the partner as well. So we have to be aware of these things, but there are strategies that can help you recognize it, manage it, and prepare for it. Because if we don't prepare for it, we end up getting surprised by it. And if we get surprised by it, it can sometimes be a little tricky. So in webinar 4, we're going to look at what makes narcissistic personality disorder and their relationship so hard to diagnose and treat.